to you a little bit about Lyme disease treatment. I've talked with several people who have been infected with Lyme disease, and the one thing I'm hearing is that after a standard course of antibiotics, they either still have their symptoms, or after going off the antibiotics for some period of time, they relapse back into their symptoms. As I go on online message boards, I kind of see the same thing with people throughout the country and throughout the world. So I guess the main topic for today's speech is that there's still much controversy surrounding the treatment of Lyme disease. Lyme disease bacteria is called Borrelia burgdorferi. It is a spirochete, like syphilis. This gives it a corkscrew shape, which gives it the ability to really kind of screw into any tissue in the body and infect you throughout anywhere in the body. The traditional treatment, according to the 2003 Merck manual, is 3 weeks of oral antibiotics for early Lyme disease, or 3 weeks of IV antibiotics for late-stage neurologic Lyme disease. Now, it's after this course of treatment is where the controversy comes in. This is where people get their treatment, they still feel sick, don't know what to do, and so on. Dr. Brian Fallon of Columbia University tried to shed some light on what's going on here. In 2008, he led a study. It was called a randomized placebo-controlled trial of repeated IV antibiotic therapy for Lyme encephalopathy. The study was focused on the cognitive problems associated with Lyme disease. The objective of the study was to determine if patients who received the standard antibiotic course for Lyme disease treatment and relapsed would benefit from additional IV antibiotic therapy. The results were that 66.7% of the antibiotic group showed improvement versus 25% of the placebo group. A significantly greater improvement was shown in patients with greater impairment at the beginning of the study. One theory on Lyme disease patients don't recover is what some theorize as a post-Lyme syndrome. The idea is that it's an autoimmune disorder that once the Borrelia actually leaves the body, the immune system is still revved up and attacks your joints and causes pain and inflammation and keeps destroying tissue in your body after the Borrelia is gone, has left the body. That theory has no scientific evidence. It hasn't been proven, and it's just one of many possibilities of why the disease may become chronic. Pamela Weintraub explains in her 2008 book entitled Cure Unknown that the reason many Lyme patients may not recover is because of co-infections. Co-infections are different infections besides Borrelia that ticks carry, such as Ehrlichia, Rocky Mountain Spotted Fever, Bartonella, and Babesia. The problem is that different antibiotics are used for all these different infections. For example, according to the 2007 book, The Top 10 Cures for Lyme Disease, doxycycline is a great antibiotic for Borrelia and Rocky Mountain Spotted Fever, but it really has no effect at all against Babesia. In 2010, the Infectious Disease Society of America reviewed their Lyme disease policy, their treatment guidelines, to try to figure out if there was something better they need to do. They came back and they ultimately stood by their theory of a short course of antibiotics to cure Lyme disease, and that they couldn't find any reason for longer therapy. They didn't see a more chronic version of the disease that warranted antibiotic therapy past the standard course. What they actually came out with was 2 weeks of IV antibiotics for late neurologic type symptoms of Lyme disease, which, as you will remember from earlier in the speech, that's less than what the 2003 Merck manual recommends. So anyway, the science on Lyme disease continues. Many states, including Minnesota, have passed laws protecting physicians who treat Lyme disease. This gives them a lot of latitude to treat however they see needed, and they don't have to fear being reprimanded by the state board and having their license taken away and whatnot. Minnesota recently passed a law, and their law gives physicians a 5-year period while the science is still out on Lyme disease to treat patients how they see fit. So anyway, as you can see, there still is much controversy. Colleges and universities in the United States and around the world are trying to sort it out. And that's where we stand today. Thank you for being my audience.